If you're looking for information specific to your state about Medicare, I have a terrific section on my website. Just visit MedicareOnVideo.com. You hover over Medicare supplements, and you'll see at the bottom it's plans by state. Click on that. It's going to bring you right to a map of the United States where you can scroll over and click on any state, and it'll bring up exactly what the rules are in that state for Medicare supplement plans. Very helpful and very easy to use. And right now we're going to talk about Washington State and what makes Washington State a lot different, not just a little different, but a lot different than most every other state. And I'm Keith Armbrecht, founder of Medicare on Video, and I make it easy to figure out your Medicare choices. And we want to be as creative as we can. We want to utilize all the rules that are given to us, and some states have more rules that benefit us in certain ways. So we want to make sure we understand that, and that's one of the things in Washington State that makes it different than every other state. They have created some rights to the consumer, which are nice to have, but it also raises the prices because you have more guaranteed rights coming into an insurance plan. So I'm gonna go through that right now and show you what I would choose if I were a Washington State resident choosing a Medicare supplement plan coming into Medicare. And it's a pretty easy decision. I'll show you right now. So when we look at Medicare supplements, generally across the country, it's going to be Plan G or Plan N, just depending upon the price difference between those two. If you've watched my other videos, you know it's fantastic coverage. It's absolutely what we want to have in Medicare. Plan G covers almost everything with a small deductible. Plan N just adds a few copays. But in Washington State, it's a little different. So the plans are still there, but they cost more. And I'll show you why they cost more. So when we run a quote for a Medicare supplement Plan G in Washington State, this is what we get. And you can see right here that the choices are a bit limited. But what's important to notice here is what it says at rating type. And it shows community rated. So what does that mean? Community rated. It's kind of a tough scenario where most are based on the age that you are coming into Medicare. Community rated means no matter how old you are, no matter whether you're male or female, everybody's going to have exactly the same price. So some would argue, well, that's the most fair way to do it. It makes no difference how old you are or whether you're male or female. You're all going to have the exact same price. And it's kind of true, but it's terrific for an 80-year-old. It's not so terrific for a 65-year-old because you're paying exactly the same price, which means 65-year-olds are paying more, 80-year-olds are paying less because it's going to be a median between the two. So you can see here when we change to 80-year-old for the exact same scenario, it's exactly the same price. So if we were choosing a Plan G in Washington State, we would likely be choosing Cigna at $194.88, period, because it's exactly the same. There's nothing that'll differentiate it between age or sex, gender. If we go to Plan N, you can see it drops in price, which is pretty significant. So $139.78, and again, community rated. So it doesn't matter how old you are, doesn't matter male or female. This is what the rate's going to be. And I would likely choose N over G because my line is $25. If N's $25 less than G, I'm likely going with G. But what I want to do in Washington State is maximize my benefits and my rights. Washington State also has year-round open enrollment. So year-round open enrollment is a huge thing to understand. It's only there in 2, maybe 3 states where you have just full rights, meaning you can change a Medicare supplement plan anytime. You can go from one to another to another without any medical questions. You can just do it the first of the next month effective date, jump into a different plan. So what does that mean? That means we want to look at our best value. If we're in good health right now, we don't need all the benefits of G. We don't need all the benefits of N. What we want to look at is Plan GHD. So Plan GHD is just Plan G with a higher deductible. That's what the HD stands for. So you can see here, community rated. it's $44 in Washington State. It might even be the most competitive GHD in the country. And we write just a ton of it in Washington State because this is what makes sense. So when you have this $44 premium, you can see that'll make a difference of $1,800 a year less than regular G in premium. So the difference in deductible, plan regular G has a $226 deductible. It's the Medicare Part B deductible. Plan GHD has a $2,700 deductible. So it's a big deductible, but you wouldn't pay $1,800 more in premium to cover that $2,700 deductible. And understand as well, that's probably close to the deductible you have now coming into Medicare. But what makes it even more attractive is we can go on the GHD, and then if something comes along where we know we're going to need medical care in the future, we can jump to Plan G or Plan N the first of next month without any medical questions. All we have to do is put in an application, and it'll go to that $194 rate with Plan G or the $139 with Plan N, depending upon what situation makes more sense. But it's just taking advantage of our rights, and this is what we like to do. We want to make sure that we get the best value of our plans. And when you have year-round open enrollment, it's the same in New York as it is in Washington State. You want to take advantage of that. So take the lower cost plan while you don't need it for health issues. And if you do in the future need health issues, you can easily move to a higher level plan. So it makes a lot of sense to do that. So I hope you found this helpful. Make sure to utilize as much information, and hopefully you'll allow us to help you. That's how I make a living. There's no cost to you to allow me to help you. Whatever insurance carrier we choose, they're going to pay me a little to be your service agent now and in the future. So hopefully you found this helpful. I'd be happy to set it up. You won't find most agents offering you this because they just don't make any money on it. So, but that's not an important part of it. We want to do what's right for you and make sure that you get put in the best position. So I'm going to show you right now how to download my free book, Medicare Made Clear. You'll find that very helpful as well. Hope you have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll also find very helpful. Number one, download a copy of my free book, Medicare Made Clear. I spent a lot of time and a lot of effort putting this together, and it has everything that you need for Medicare now and in the future, down the road. I have videos in the book. I have all the links that you need for things that you'll want to do within Medicare. You can access it right in the book. Very easy to do. Just visit MedicareOnVideo.com/free book, and you can download it for free. You can save it on your computer. You can save it on your iPad. It's a great resource to have, again, for now and in the future. Another thing that you'll find helpful is down the road, when you come into Medicare, sometimes it makes sense to do a price check on your Medicare supplement plan. So I made it very easy to do that as well. Just visit MedicarePriceCheck.com, put in your basic information, and we'll email you a quote on your same plan that you have right now, a G or an N or an F, whatever it may be. And likely we'll be able to save $20 to $60 a month in premium, because a lot of times plans come out with better rates. So if we can get a better rate for the same plan that we currently have, just makes a lot of sense. And then obviously take advantage of all the information on my website at MedicareOnVideo.com. I have everything that you need right there for understanding IRMA, understanding employer work coverage, everything that you need, especially in the guides and forms section, you'll find right there. So we update everything every year, so everything should be up to date and current with the right deductibles and premiums and things like that. Hope you found all this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.